I became a part of the nursing workforce 10 years ago when I passed the Philippine Nursing Licensure exam back in June 2011. When I was still studying to be a nurse in the academe, I pictured myself working in clinics and hospitals, day in and day out, as a regular staff nurse selflessly caring for my patients. I would soon realize that after several years into practicing my profession, seeds of ideas start to grow in my mind. There is something very dear to my heart that I would love to do. Teaching. Teaching has been a great part of my daily life, not only as a nursing responsibility to my patients, but more of a passion that drives me into dreaming something and taking action on it to become a reality. I want to become a clinical educator someday. That is why I decided to enroll in the graduate school. I want to teach young minds and be passionate about teaching. I want to hone future nurses to what they are supposed to become in their chosen profession. I want to make a difference and leave a legacy. Those ones actually became my hopes. But how are my hopes related to what I'm going to tell you today? Well, maybe I'm not the only one who wants to pursue in being a clinical educator someday. Maybe some of you also has the same hopes of getting into clinical teaching. So from this point onwards, allow me to start calling you as clinical teachers, my co-teachers. Now, in clinical teaching, there is the concept of what we call preceptorship, and I would like to walk you through this type of clinical teaching method. But before that, you need to know that the use of preceptors is an alternative to the traditional method or traditional model of clinical teaching. It is based on the assumption that a consistent relationship between an experienced nurse and a nursing student or novice staff nurse is an effective way to provide individualized guidance in clinical learning. A preceptorship is a time-limited, one-to-one relationship between a learner and an experienced nurse. It provides opportunities for socialization into professional nursing roles. But as clinical teachers, how do we select preceptors? Selection of appropriate preceptors is one of the teacher's most important responsibilities. Your responsibility as a teacher. The desire to teach and willingness to serve as a preceptor are important qualities of a potential preceptor. If they feel they are obligated to enact this role, then they may not be an enthusiastic and effective preceptor. To be effective, it is important to have the clinical expertise or proficiency, leadership abilities, teaching skills, and the professional role behaviors and attitudes. As preceptors, they must act as role models for their learners. Accountability, maturity, self-confidence, flexibility, open-mindedness, enthusiasm, sense of humor, and the willingness to work with a diverse population of learners. These are just some important professional values that a preceptor must possess and demonstrate. As a clinical teacher, we must carefully screen and select preceptors to ensure that they meet the requirements of the nursing education program, taking into account the learner's interest in a specific clinical specialty, as well as the need for development of particular skills. After preceptors have been selected, they need a specific orientation to their responsibilities. This may be in the form of face-to-face or telephone conference, and it includes orientation about the educational level and previous experience of the student, how to choose specific learning activities based on learning objectives, scheduling of clinical learning activities, and how and what circumstances to contact the faculty member. Meanwhile, our learners also need to understand the purpose and process of the preceptorship. They need an orientation to the process of planning individual learning activities, an explanation of teacher and preceptor roles, and a review of unit policies specific to their practice. For preceptorship to be successfully implemented, there must be a mutual understanding of the roles and responsibilities of the participants. The key to this is frequent, clear, and effective communication among the participants. In preceptorship, preceptors are responsible for patient care in addition to clinical teaching of the learner. He or she functions as a role model that provides individualized clinical instruction, coaching, support, and socialization for the learner. Preceptors create a positive learning environment and provide feedback to the learner and the teacher. Technical and technology skills, interpersonal skills, clinical reasoning, and professional role behaviors are the important role model behaviors that a preceptor should demonstrate. You, as a teacher, on the other hand, is a faculty member or educator who has overall responsibility for the quality of the clinical teaching and learning. You provide the link between the educational program and the practice setting. You are responsible for making preceptor selections and pairing and orienting learners with the preceptors. But sometimes, when preceptors perceive that their learner is unable to perform patient care tasks appropriately, they are often tempted to step in and take over by demonstrating the proper technique. However, doing so interferes with both the students and the patient's perceptions of the student as an authentic care provider. Now, to support learners in this situation, as they learn to care for patients, preceptors should use what we call the coaching process. Just imagine yourself playing the sports that you love with a coach. Your coach just stands on the sidelines and he or she does not participate or interfere with the game unless there is a risk of injury. That is how the process of coaching works. A good preceptor using coaching techniques allows the learner to be in control of the patient situation and stands nearby, monitoring the unfolding situation, offering verbal cues when needed, asking questions to guide the student's problem solving, offering encouragement such as, "That's right," or "Keep going," and then giving immediate feedback for the students to reflect on. The coach's expression of belief in the student's capacity to succeed helps the student develop self-efficacy and self-confidence. Effective coaching can help students feel more confident in their clinical abilities and see themselves as authentic care providers. If a student freezes because of overwhelming anxiety, an error, inadequate preparation, or an unexpected occurrence, the preceptor may need to intervene if this places the patient at risk. The preceptor may need to temporarily assume responsibility for the task the student was attempting to perform, beginning or taking the next step of the task and then encouraging the student to continue while continuing to coach from the sidelines. But how do we evaluate the outcomes in the preceptorship model of clinical teaching? Student performance may be evaluated through the clinical evaluation methods used by the educational program or according to the terms specified in a learning contract. A learning contract is an explicit agreement between a teacher and student that clarifies expectations of each participant in the teaching-learning process. It specifies the learning goals that have been established, the learning activities selected to meet the objectives, and the expected outcomes and criteria by which they will be evaluated. If a learning contract is used, student self-evaluation is usually an important strategy for assessing outcomes. Preceptors are expected to give feedback to the learner and the teacher, but the teacher has the responsibility for the summative evaluation of learner performance. Also, an important aspect of evaluation concerns the teaching effectiveness of preceptors. Students are an important source of information about the quality of their preceptors' clinical teaching, but the teacher should also assess the degree to which preceptors were able to effectively guide the students' learning. Now, if preceptors make valuable contributions to nursing education programs, Do they need to be rewarded? Well, the answer is yes. They should receive appropriate rewards and incentives for their participation. At minimum, every preceptor should receive an individualized thank you letter specifying some of the benefits that the student received from the preceptorship. Although many preceptors prefer non material rewards such as light workloads and support from managers and teachers. In a nutshell, using preceptors as clinical teachers and coaches is an effective alternative to the traditional method of clinical teaching, and collaboration is essential to minimize drawbacks and achieve advantages for the educational program, the teachers, preceptors, and the students. Preceptors give praise. They are reliable. They encourage learners and they act as coaches. They evaluate learning outcomes and they are patient for their learners. They do not only teach, but are open minded in being taught along the process because he or she respects that learning is a two-way process. Thank you, and may all of us make a difference and leave our own legacies.